I would definitely take it.
I would not get vaccinated.
I'm on the fence.
Vaccination is the only thing that can get us out of this situation.
The COVID vaccine is looking more like a reality, with some trials showing promising results. It's the only thing that can rapidly stop this pandemic. Vulnerable and older people will be first in line. But young people will need vaccinating eventually to stop COVID spreading, but some are questioning whether they would want one. This King's College London study suggests 16 to 34-year-olds in the UK are twice as likely as 55 to 75-year-olds not to want a COVID vaccination. Meanwhile, in the US, one poll by Pew Research found only 56% of 18 to 29-year-olds they asked said they would definitely get a COVID vaccine. Some young people question why they would need to get a vaccine if they're low risk, and this has got the World Health Organization worried.
Young people are an incredibly important part of ending this pandemic. It will be really important for young people to be vaccinated because we know from what's going on now is lots of transmission is going on among young people.
So where is this concern coming from? Well, partly it's about the volume of misinformation we're being exposed to. Hashtags like vaccines are dangerous and TikTok videos like this one are wrongly suggesting the vaccine could be dangerous to us. And some people are worried about the speed at which things are moving.
I believe in the power of vaccines, but I'm having some trouble right now trusting the federal government and believing that anything pushed out in this short time frame has had rigorous tests applied to it to make sure that it's safe long term.
We are concerned that there are some people who are questioning whether vaccines are safe. There is absolutely no compromising on the scientific evidence that's being collected and is being scrutinized around the safety of these vaccines.
Even at this speed.
We get speed because there's so much support and funding that we can move quite quickly from one stage to the next without having to pause for several years and search for additional support and funding.
So here are the key points. If you're under 35, don't forget you can still get COVID and become very ill. Even if you're not worried about getting the virus yourself, you could still spread it by not getting a vaccine, and that would stop herd immunity from developing. And finally, all COVID vaccines will have been tested on tens of thousands of people and gone through tough safety checks before you even get one.